I'm Dr. Vandi MS. Welcome to my channel SPM World. A case of Kyasanur Forest disease, also known as monkey fever, a viral disease transmitted to humans through a species of ticks usually found on monkeys, has been reported recently from Wayanad. The details you have to know, that is how it is transmitted, clinical features of the Kyasanur Forest disease, and how we can prevent the disease. I'm going to share with you today. So, Kyasanur Forest disease is a febrile disease associated with bleeding caused by an arbovirus flavivirus and transmitted to man by bite of infected ticks. The Kyasanur Forest disease, that is KFD, was first recognized in 1957 in Shimoga district of Karnataka state in South India. Local inhabitants call the disease monkey disease because of its association with dead monkeys. The disease was later named after the locality, that is Kyasanur Forest, from where the virus was first isolated. So thus the name got it as Kyasanur Forest disease. Coming into mode of transmission, the transmission cycle involves mainly monkeys and ticks. The disease is transmitted by the bite of infected ticks. Especially those who travel to the forest areas will get the disease, and there is no evidence of man to man transmission. Coming on to clinical features, the disease appears with a sudden onset of fever, headache, and severe myalgia with prostration in some patients. And gastrointestinal disturbances and bleeding from nose, gums, stomach, and intestine may occur in severe cases. And there is something called as meningoencephalitis, that is some persons will get the meningoencephalitis after an febrile period of 7 to 21 days. After an no fever period of 7 to 21 days, it is manifested by a return of fever, severe headache followed by neck stiffness, coarse tremors, abnormal reflexes, and mental disturbances. The most important thing is that the case fatality rate has been estimated to be 5 to 10 percentage. And finally, the important area in this scenario is how we can control the spread of this disease. Under these three things we have to remember. First one is control of ticks, second one is vaccination human beings, and finally personal protection. That is yet another important thing. First of all, control of ticks. How we can control tick is that we can apply certain insecticides such as carbaryl, fenthion, propoxur at 2.24 kilogram of active ingredient per hectare using power equipment or by aircraft mounted equipment. And the spraying must be carried out in hot spots. Okay, in hot spots we have to spray the insecticide. How hotspot is that in areas where monkey deaths have been reported within 50 meters around the spot of the monkey deaths besides the endemic foci. And the second one is vaccination. The population at risk should be immunized with killed KFD vaccine. And finally, regarding personal protection of individuals exposed to the risk of infection by adequate clothing and insect repellents such as dimethyl phthalate, that is DMP, DEET, should be encouraged. They should be educated regarding proper clothing when they enter into the forest area, and they should examine their bodies at the end of each day for ticks and remove them promptly. The habit of sitting or lying down on the ground should be discouraged through health education. These are the things we can do for controlling the spread of Kyasanur forest disease. Thus, this disease was detected in Wayanad recently, and before that, the case of Kyasanur forest disease was first detected in 2013 in the same district, that is Wayanad, and following that, yet other confirmed case was detected on 2014. After that, this year, that is 2022, again the case of Kyasanur forest disease was detected in Wayanad. So we all have to be careful when we enter into the forest area. We have to take the necessary steps in order to prevent, in order to contain the spread of Kyasanur forest disease. So thank you all for watching. If you like this video, please share with your friends and also subscribe my channel so that you will get all videos related to recent advances in medical field and in public health that I'll upload in this channel. So thank you all for watching. Thank you.